Okay, we're gonna get started. I want to welcome Jess White, who's a registered psychotherapist who deals with sleep disruptions, emotional overwhelm, alcohol use, and life transitions. Specifically today, we're going to talk about sleep issues in midlife, which are crappy, really crappy. And we're going to record this, so if there's stuff that you want to rewatch, and for those that weren't able to make, we'll be recording. So no swearing or anything, okay? Sitting by the camera. Thanks, Jess.
All right, thanks for coming tonight. Although I'm going to be talking some areas specific to midlife, it really is the whole gamut because it is reported that 90% of women between the ages of 35 and 60, and I would say even higher, report issues of sleep. So sleep problems, sleep disruptions, problems waking up too early. And so it's a really important topic and one that's close to my heart. I was just sharing that I've been working in the area of sleep for over 15 years, started with children, expanded to adults, and now I work with other areas as well. So today what I'm going to be focusing on is really understanding the importance of addressing sleep issues, because I think there's this belief that we just are supposed to struggle and our sleep's supposed to be crap for, you know, the last half of our life, and I don't agree with that. And so I'm here today to share with you what the factors are that create these sleep issues and help you kind of identify what might be the root cause of issues. And in a lot of cases, and this is something I like to emphasize as well, is that it's not always just one thing. And I think that that can actually create a lot of anxiety for individuals, thinking, hey, there's just this one thing that I have to do and then I'm gonna sleep. And that actually is inaccurate. There's a support system that is put into place. And so first of all, understanding what the factors are and how we can treat those particular things that may be causing the sleep disruptions, and then getting an idea of understanding what perpetuates the sleep issues. What are we doing in response that actually worsens sleep? Because I would say that that is what most people are struggling with, is the behaviors or the thoughts. And really, I just want to leave you empowered in taking next steps to improve your sleep. So we all know this, but I'm just going to share it again. The importance of sleep is that it is the reset button for our bodies and minds. We go through 5 cycles of sleep through the course of the night, and each cycle is specific for different reasons. So if you're missing out on the first cycle, you're going to be missing out on NREM sleep. That's when we make most of that type of sleep. And that's really important for clearing out the debris, clearing out the information we don't need anymore, and making room for new memories and new information. And as we cycle through those 5 cycles of sleep, the last 2, we spend more time in REM sleep, which is really, really important for emotional processing and memory consolidation. So if you are one that wakes up at 4 o'clock in the morning and you're missing out on that last cycle of sleep, then your REM sleep is being impacted, which will lead to experiences of anxiety or difficult regulating emotions during the day. Sleep also helps speed up healing and helps with aches and pains. Good sleep helps prevent disease, and it helps to reduce sugar cravings, because when we're overtired, we tend to crave sugar, because there's hormones that are released when we've slept well that tell us when we're full, when we're satiated, and when we are underslept, those hormones aren't working properly. And so we have a really hard time making good decisions about our food. So, what are some of the common sleep issues that you are experiencing or have heard other people experiencing? What are the things that you've heard of or struggle with? Waking up too early.
3 and 4 in the morning.
Waking up too early.
No, 3 in the morning. But going back to sleep, I can go back.
But it's that waking up,
Yeah.
maybe being up for a period of time, or not getting back to sleep at all. Okay.
I find that I go to sleep okay, and then I wake up about a short time after, and then I'm up for a bit, like I can't, and I'm still sort of asleep, but it's like I'm awake, and it's like I just fell asleep.
Yeah.
And then my biggest issue is I can't get up in the morning.
Okay.
I'm like, I hit a snooze button.
Right. Okay.
So
well, in midlife, which I'm kind of focusing on, but in general, the most common issues are not being able to fall back asleep, or not being able to fall asleep, waking up due to hot flashes or night sweats. So we were talking earlier about how a lot of women's sleep issues start in perimenopause, menopause, and if you were one of the unlucky ones to experience vasomotor symptoms, the hot thermoregulatory piece, then that can be the cause of the wake up or can contribute to that. Being awake for long periods, waking up too early, and the big one that isn't talked about as much is that just feeling of fatigue and exhaustion during the day. And so these issues with, as I said, with the 90% piece, is that when women are going through midlife, perimenopause, menopause, the report is that 4 times more women have troubles falling asleep, and two times women, I can't remember all my stats tonight, but women are 2 times more likely to feel unsatisfied with their sleep. And so that's a big one. That's one I hear all the time in my clinical practice is unsatisfied. I don't feel well rested. I don't feel well rested. And so that number 5 is important because it's not always things that we talk about when we talk about sleep. So the reason why I really want to emphasize the importance of addressing the root cause is because there's a lot of risks and concerns if we just accept this, oh, I just don't sleep well. The first and foremost is that the sleep issue can actually be a sleep disorder. So it could be sleep apnea or restless leg syndrome. We were talking about delayed sleep phase disorder earlier. If left untreated, it can turn into insomnia. If it's unaddressed, like what I was just talking about, the fatigue during the day, it can lead to more serious, or it can be a symptom of a more serious medical issue. So that daytime fatigue can actually have nothing to do with sleep at all and be the symptom of something else. If left untreated, it can increase our risk for serious psychiatric and medical comorbidities, depression, anxiety, suicidal ideation. It can exacerbate other menopausal symptoms. It leads to irritability, distress, weight gain, inability to cope or function, and then it can lead to coping strategies that increase the risk of other physical and mental health concerns. If left untreated or poor sleep goes on for a prolonged period of time, it actually doubles our risk of cancer, increases our risk of cardiovascular disease, and has been linked to Alzheimer's disease. So in summary, there's short-term and long-term physical and mental health impacts of untreated sleep issues is quite significant. So the factors that impact sleep are mental health, other medical conditions, hormonal changes, menopause symptoms if we're talking about midlife. And what I want to do is go into a little bit more depth of each of these, give you some assessment tools to determine if maybe this might be the cause of your sleep disruption so that you have an appropriate treatment path. And the reason why I emphasize this so much is that what I find is that people will have sleep issues. They'll go to their doctor will tell them one thing. They'll go to their naturopath will tell them another thing. And that really wide holistic lens is often not there because of timing, right? Or just not educated. So we were talking earlier about CBTI. CBTI is cognitive behavioral therapy for insomnia. It is a gold standard. It is the gold standard for treatment, but most doctors will just prescribe sleeping pills. And I'm sorry to say that, and if any doctors are listening, that may be changing, but it is important to recognize that there are other ways to treat these issues. So the mental health piece is really important because, like I said, left untreated, there is a bidirectional relationship between poor sleep and mental health concerns like anxiety, depression. So if one isn't sleeping well, then those symptoms are going to be exacerbated and vice versa. Anxiety, most likely you're going to have trouble sleeping. So there is an increased risk of insomnia with depression, anxiety, and PTSD, but they can be treated concurrently, meaning if you are seeing a psychotherapist for anxiety or depression, you can also receive CBTI treatment. And CBTI treatment, although designed for sleep issues, disturbances, it actually has been shown and proven to reduce symptoms of depression and anxiety and PTSD as well. The next next one, and this is the medical conditions that I was speaking about, is that if you experience a lot of daytime sleepiness, meaning the propensity to fall asleep like that, it can be a red flag or a sign that you actually have an obstruction or experiencing obstructive sleep apnea. The other thing to recognize that as we age, our risk increases. And so it's important to assess yourself. If you want, you can use these tools, and I'm just gonna see if my links work here. Yeah, so the first one is called the Stop Bang, and I don't know if I can go up here, but there's, I think, 8 questions here, and you can assess your risk factor to determine if you might be at risk for an obstructive sleep apnea. And so you can take that to your doctor and say, hey, this is what I scored. Could you get me a sleep study? It takes a really long time, unfortunately, to get a referral and get into a sleep clinic. So taking that step for yourself can be a very proactive way to start that process.
How do you find this tool? Just
Yeah, so
Stop
it's
Bang?
called the Stop Bang, but I can share with you, maybe we can do like a resource list after.
Yep.
Do we have a list of the attendees? Okay.
Yep.
Yeah, so that's one of them. The next one that I use a lot with my clients or patients is the Epworth Sleepiness Scale. And again, I know it's hard to see there, but this is the questions like, what's the chance that you would fall asleep if you were sitting and reading, watching television, sitting inactive in a public place, passenger in a car? And so those points are added up, and it also will give you, what does it say, it will, if you score 1 to 6, then it's normal sleep, 7 to 8 is average sleepiness, but anything 9 and above is considered abnormal and possibly pathological, which indicates that it could be a sleep obstruction. And so with the OSA, or the obstructive sleep apnea, I have here the treatment sort of plan or treatment direction. So a sleep study, you can also go see a sleep dentist. In a lot of cases, it has to do with our jaw, if you've had like a break, or if something's happened in your mouth, like if you had, I don't know, even someone was telling me that even the placement of your tongue can have an impact. So there are dental devices that you can get from sleep dentists that are registered with the Canadian Sleep Society. And so they have training to determine if that would be effective for you. And then finally, the CPAP machine is, of course, the treatment for obstructive sleep apnea, which I think is a big deterrent for a lot of people. But the technology is changing day by day, and so the way to treat is getting better. But it is called the silent killer for a reason, because your sleep is impacted so severely, and that's why there's that propensity to sleep during the day. The second medical condition I've talked about a couple times, which is the insomnia.
Is there like a definition of insomnia?
Yes.
Or is it just regular
Good
sleep
question,
disruption?
and thank you. I should have said interrupt me at any time, or if I'm speaking too quickly. So insomnia is it is subjective, right? Because no one can measure it. So it is a subjective experience, and the subjective definition is 3 or more nights a week for 3 months or longer. So that is the definition, and it's
Like where you can't fall asleep, or?
can't fall asleep, so you can't initiate sleep, or sleep maintenance, or maintenance insomnia, which is not being able to fall back to sleep.
Okay.
So either of those are considered, when a sleep challenge, either of those have been 3 days or more a week for 3 months or longer, it's considered insomnia. And so there is a treatment or an assessment tool here called the Insomnia Severity Index. And here you can see there's the insomnia problem, difficulty falling asleep, difficulty staying asleep, problems waking up too early. You can rate your experience here. And again, you can see even in this assessment tool, it asks for the last 2 weeks, what's the severity of this problem? And then you rate your satisfaction, noticeable to others, how worried or distressed you are, to what extent you consider this problem interfere with your daily functioning, And then again, it'll give you an assessment. So no clinically significant insomnia, subthreshold. The clients that I work with fall into these two categories, moderate severity or severe. So that's a self-assessment tool you can use as well. I've mentioned it a couple times, but CBTI is the gold standard treatment, and there's lots of medical professionals that are being trained in this now. There's online programs you can do. I'm trained in CBTI. To the best of my knowledge, there's no one else local, but psychologists, psychotherapists, some doctors. But the problem with a lot of the doctors is they don't have the training and they don't have the time. Finally, the other conditions that I feel don't get enough attention have to do with our blood work, menopause, perimenopausal symptoms, and then food issues. And so all three of those things can cause the sleep disruption, can cause broken sleep, and can cause the way you feel during the day. So the first one I say, getting a blood panel, getting your ferritin levels checked. So low iron will cause a 3 or 4 a.m. wake up. And that low iron can even be in the normal range, the low end of normal. So if that is the case, then it is important to get that treated. Vitamin D deficiencies also can cause sleep deficiencies and thyroid issues. So that is something that you can follow up on. Perimenopausal, menopausal symptoms, I'm going to talk a little bit more of those in a minute. History of disordered eating, insulin resistance, which is an issue as we enter midlife, or can be an issue. And if you're not eating enough during the day, so if you're restricting or not eating enough protein, eating a lot of carbs, that can lead to a blood sugar crash, which will also lead to that 4 a.m. wake up. So that's important to recognize again, because here's the thing, we want to be figuring out what's causing the wake up. That's the first part of my talk tonight. The second part is how do we respond to it in an effective way. So again, the treatment path here may be supplements, it might be medications, it might be MHT, menopause hormone therapy, might be psychotherapy, or it might be a nutritionist. So, and it might be a combination of all of those things. The piece at the bottom, just this little star, just says seek treatment from a medical practitioner or professional. Any questions about any of these things? Okay, so next piece are the hormonal changes, and again, this is speaking to midlife. But declining estrogen levels will lead to, or can, pardon me, lead to hot flashes and night sweats, and an overall decline in sleep quality. Declining progesterone levels can lead to anxiety and making it really hard to relax and let go. And that is a necessary process for that sleep wave to happen, is that ability to let go. And finally, and this is important as well, is as we age, our melatonin levels decline. And so even though we need just as much sleep as we did when we were earlier in adults, it's harder to generate sleep because of these fluctuating and declining hormone levels. In some cases, melatonin might be indicated, but again, I like to point out that it is not regulated in Canada. So a lot of the melatonin products that are sold aren't actually what is on the bottle. And there's no evidence that supports over 3 milligrams of use. And I would say most people I know that are using melatonin are using 10 milligrams or above, and there are severe side effects, meaning that grogginess and kind of disoriented and feeling that you may be feeling in the morning might not have anything to do with your sleep, but it might be the melatonin. So just dropping that in there. And lastly, actually, I'm just gonna say melatonin doesn't initiate sleep, it initiates sleep timing. So for shift workers, it can be a really helpful tool. If you're flying overseas, awesome tool, because you wanna get your body clock on the new time zone. Melatonin can help with that, because it'll help with your circadian clock. It doesn't initiate sleep, and I think a lot of people think it does. Any questions?
So what does it do then? I mean,
It
initiates it, is it relax? What does it do?
It tells your body when to be tired.
Naturally, but if you take it, does it do that too?
Yeah, so you would take it an hour before bed, and that it's gonna tell your body, okay, I'm getting tired now, I'm switching into yeah, yeah. But it doesn't make you sleep.
So if you're saying a lot of it is not good quality, how do you know?
It's not that it's not good quality, it's just that because it's not regulated, the amounts might not be what's on. So it might say it's 5 milligrams and it might be 2. Or it might be the other way, it might actually be 8. Yeah. And it is regulated in most other countries in the world, which is fascinating because Ontario or Canada feels like it has fairly strict, but for some reason melatonin, or I guess it's supplements, but yeah, so it's again, I'm not against melatonin, but I think it's got a use, time and a place. Okay, so perimenopausal, menopausal symptoms. Again, I highlight the piece around cycling. As we go into perimenopause, our periods can become prolonged and really, really heavy. And so you can understand how that can potentially lead to iron deficiency anemia. And that can be the cause of that fatigue during the day. And so I point this out because I think it gets missed a lot, especially when we're talking about perimenopause and menopause with our doctors. So ask about it, get a blood panel done, and iron supplements can be helpful. And in some cases, I've had clients that actually are on iron infusions because their levels are so low. So again, we're ruling out or treating the things that may be causing the symptoms that we're experiencing. Night sweats, hot flashes, frozen shoulder, joint pain, all the results of fluctuating hormones, lead to sleep disruptions and prolonged awakenings, and MHT, menopause hormone therapy, can be really helpful for alleviating those symptoms that are going to cause the sleep disruption. So again, we want to be making sure that we are treating the root cause of the sleep challenge. Other considerations at this time, or just for being women, is that we are always involved in caring. So caring responsibilities, midlife, the sandwich generation, kids and parents, our relationships start to change, career changes, or we retire, lifestyle that was working might stop working, or things that you were doing don't kind of work anymore. Food, alcohol, drugs, stress has a significant impact on our hyperarousal system. So that's one of the things that's going to prevent sleep or inhibit sleep, and I'm going to talk more about that. Also, losing people at this stage in life and as we get older. So grief can really impact our sleep and cause sleep disruptions. And lastly, medications. So side effects of some medications can be hyperarousal, making it really hard to initiate or stay asleep. So taking all these other factors into consideration is also important. So the next part of this talk is that when we start to struggle with sleep, or when sleep starts to get crappy, when sleep starts to disappear, we get involved. We start to help ourselves, or we start to do things that help us cope and manage. And it's these behaviors that are often the thing that are perpetuating the sleep issue, which are worsening the issue, or over time will lead to insomnia. And so the things I have on here are getting into bed early. I would say the most common behavior that I see with people that are struggling with sleep is getting into bed early because they want to try and catch up, or get sleep if they're not going to sleep. Well, I'm gonna get to sleep early, or stay in bed in the morning. Drinking is a sedative, right? So it does help with initiating sleep, but it wreaks havoc on your sleep later, which I'm going to share a couple things about. Canceling plans. When people's sleep starts to disappear, people start canceling their workouts. They start canceling their plans, and that's one of the things that's actually going to create worse sleep. Napping for prolonged periods, or for later in the day, drinking more coffee, and then when not sleeping, what are you doing? Are you staying in bed on your phone? Are you watching movies? Are you listening to podcasts? What are the things you're doing when you're not sleeping? So those are the coping strategies are the things that I really want to focus on for the next part. just quickly, I want to talk about the alcohol. So unfortunately, women appear to experience sleep-disrupting effects of alcohol more significantly than men. The dose and timing is really important, meaning the negative impacts increase with the amount of alcohol and how close it is consumed to bedtime. The big thing here is the REM sleep disruption. So alcohol suppresses REM or dream sleep, and when we have disrupted REM sleep, it leads to anxiety, irritability, depressive states, memory loss, difficulty concentrating, and decreased performance. And there's an REM rebound that happens. So the night that you drank, you might not notice anything, but the next night, what happens, and this is actually a really cool thing that our body does for us, is that whatever type of sleep you missed out on the night before, your body will make more of it the next night. It's always trying to maintain balance, which is great. However, if you've missed out on a lot of REM sleep, that REM sleep rebound that can happen with the drinking is really dysregulating and leads to poor quality sleep. And it's the feeling that you have when, it's kind of likened to jet lag. So it's like, you might be dreaming more, you might have more nightmares, but it doesn't feel like it was good quality. The other thing that happens is that melatonin suppression can be up to 20% with alcohol, and the resulting poor sleep, you guys can't see this, but the resulting poor sleep and circadian rhythm disruption contributes to stress hormone imbalance and weight gain. So I know that's a lot of negative things, but I think it's important to understand.
So when you say stress hormone, cortisol?
Yeah. Okay, we talked about this a little bit. So going back to that diagram I showed with all the pictures, the coping strategies worsen sleep but can eventually lead to insomnia. And again, this is just the definition of insomnia. It's the most common sleep disorder. There's sleep onset, inability to fall asleep, and sleep maintenance insomnia, inability to stay asleep, prolonged period of 3 or more months. So I think it's important to share why the coping behaviors or the coping strategies, you need to understand how sleep-wake cycle, and this is the most important piece. So if you don't take anything away from tonight, listen now. So there's 2 biological functions that tell our bodies when to be awake and when to be asleep, and those are circadian clock and our sleep-wake homeostasis, also called sleep drive or our sleep pressure. So those 2 biological functions run in parallel. That's what makes us sleepy when it's nighttime and when it's the day. That is actually hereditary. So you might have, we were talking about delayed sleep phase disorder. When we're younger, when we're babies, we have an early sleep time. When we become teenagers, we sleep later, go to bed later, wake up later. When we're adults, we start to shift earlier. So that's called our sleep chronotype, and that shifts dependent on our age. But there actually can be, there's a sleep disorder that is actually when you're sleeping during the day and when you're awake during the night. So there is something genetic about it. It can be a disorder. The other thing that we need to take into consideration are, like we were talking about the stress hormones, there are external factors that also get involved with our sleep-wake cycle. And those are all the things we were talking about: the grief, the stress, the financial worries, the social factors, temperature, food or not enough food, drugs. All those things can also interfere with that process that just wants to do its thing, right? The circadian rhythm tells us when to be sleepy and when to have good REM, or when REM sleep should happen. The sleep-wake homeostasis is directly related to our quality of sleep. And so we want to support those things. And so when we talk about the coping strategies that get in the way, those are the things that are being impacted. And I'll show you why. So if we look at the homeostatic sleep drive, which is our sleep pressure or our hunger to sleep, you can see that a certain amount of time has to pass over the course of the day in order for this to peak. And it's similar, you can use the analogy of it's like a balloon. So if you think of when you wake up in the morning, you're like a flat balloon. And as time goes on, want that balloon to be full when you go to sleep so that your sleep quality and your sleep efficiency will be good. So again, it's a certain amount of time has to pass. And this is for someone that sleeps 7 to 11, okay? So again, if you're talking about timing, some people might be 5 to 9, some people only need 7 hours sleep, so they might be 5 to 10. So it just depends, or whatever, you can do math. But you understand that this is a natural process, so we want it to be full. Meaning, if you're getting into bed at 9 o'clock because you're worried about not sleeping, your balloon's not full yet. And so you're not going to be tired. And you're actually gonna be lying awake, frustrated and irritated that you're not sleeping. Or you might fall asleep, but because your balloon's not full, you're gonna wake up repeatedly because that sleep efficiency is poor. That balloon wasn't full. Yeah.
How do we know when our balloon is full?
Well, good question. That is, well, everyone has a different amount of sleep that they need, but it is essentially based on how much sleep you need.
Right.
So if you think of yourself as a 7-hour sleeper, then you're going to need approximately 17 hours before your balloon is full. If you nap for prolonged periods of time during the day, then that's gonna take air out of your balloon.
Okay.
So that's why napping's not a bad thing, but I'm gonna tell you just kind of the rules around it in a second. The other thing that really helps to blow up our balloon is exercise and movement and socializing. So when I said earlier that canceling plans can actually decrease your sleep quality, that's why. Because you're not doing the things, you're not being active. You're not filling up that balloon with air. The other line here, the green line, is our circadian drive, in this case for arousal. So you can see that our alerting signal starts when the sun rises in the morning, or for this person at 7 a.m. And it's telling them to be awake, to be awake, to be awake, to be awake. This is related to our cortisol levels. At around 8, 9 p.m., actually a little bit later, that cortisol level starts to drop and our melatonin signaling starts, indicating sleepiness. So again, as cortisol levels drop, melatonin rises, and our sleepy, all the clocks in our body are saying it's time to sleep, it's time to sleep. And what we want to do is match that. We want our balloon to be full at the same time as our circadian clock is saying it's time to go to sleep now. If those aren't lined up, then there's going to be challenges, right? The thing that really helps strengthen our circadian clock is routine and light. So when we get light in our eyes first thing in the morning, it actually tells our brain when to start producing melatonin in the night. When we feed our body, our circadian clocks, with consistent routines, it strengthens our sleep timing, meaning we get up at the same time every day, we eat our meals at the same time, we go out and exercise around the same time. That's all feeding that information back into our circadian clock, and our circadian clock likes to know what's going on. And that's why when we travel to different time zones, it's so disrupting, because our body clocks are not on that time zone, so we feel jet lagged. Any questions?
So how come some people get really tired at 10 o'clock and have to go to bed at 10 o'clock, and and need 7 hours, so they get up at 5, and then, but their partner goes to bed at midnight and doesn't get up?
Because we're all different. We all have a different fingerprint of sleep.
And can you manage that? Like, can you shift that time?
You can shift it.
Is it beneficial to do it? Or
No,
does it
I don't think so. I think that if you have the flexibility and you don't have to wake up for a certain job and you can be on a certain schedule and that works for you, then I think it's great.
Okay.
But if you want to, if you have to, or you want to shift your schedule, you can. And I would say the first thing to use is light.
Okay.
Light is gonna be your best friend in that. The earlier you get light in your eyes, but actually that can work against you too. So the flip of this is, if you tend to get up earlier and you don't want to get up earlier, don't get light in your eyes. Keep the shades drawn. If you have to go out, wear sunglasses, even if it's a cloudy day, because we are nature and our bodies pick up on all of the cues. So if you want to have a later sleep time and a later wake time, then keep things dark. Dark, you can leverage light and dark to help with your schedule. But back to your question, we all have different sleep needs. So some people only need 6 hours, some people need 9. The range is between 7 and 9, and 8 is not the magic number. And so I highlight that because I think people can get really fixated on, oh, I need 8 hours, I need 8 hours. You don't need 8 hours. You might, if that's your number, but tracking your sleep can help you determine how much sleep you actually make. Not need, make. And that's highlighting that word there because you might think you need 8 hours, but you might only make 7 hours. And so that's important. So just in summary, how does this happen? And again, you can't see the insomnia at the bottom here, but what happens to create insomnia or poor sleep for a long period of time is that there's usually a precipitating factor, meaning there could be a stressful event. Christmas will cause sleep disruptions for a lot of people, right? And sleep disruptions are normal. And if we just kind of roll with it, oftentimes we'll get right back on track after a couple days, after a week, because sleep disruptions are normal. We're not supposed to sleep perfectly every night. However, if we start putting into play coping strategies like coffee, alcohol, napping, going to bed earlier, canceling plans, sleeping in, we will start to weaken our sleep drive, create improper sleep timing or a confused circadian clock, or we will be contributing to that hyperarousal, that wakefulness when we actually want to be sleeping, which over time leads to insomnia. So, I know people are getting sleepy, so I'm going to end with what are the evidence-based strategies you can do to support the sleep regulation? So, your circadian clock and your sleep drive. First and foremost, match the time in bed to your sleep needs. So if you are an 8-hour sleeper, only use your bed for 8 hours. You might add 20 minutes on, half an hour if you, I say 7.5 hours, aim to spend 8 hours in bed for this particular example. But the longer you spend in bed, for example, if you spend 10 hours in bed but your body only makes 7 hours of sleep, you are going to have poor quality sleep because your sleep is going to be inefficient. And this is the thing, right? It works against it's counterintuitive. And so I say evidence-based because this is CBTI protocol. It's identifying how much sleep you make and then matching that to the time in bed. That will strengthen that sleep pressure and increase your sleep efficiency and make that sleep feel more rejuvenating. Consistency. I talked about that, feeding your circadian clock with consistent messages, but only getting into bed when you're sleepy and not before your identified bedtime. So if you know you fall asleep really quickly at 10:30, then that's your bedtime. And you know that you sleep for 7.5 hours, so whatever that is, that's 7 a.m. wake time, then that's your sleep schedule. So you consistently aim for that amount of time in bed. But if you're not sleepy at 10:30 for whatever reasons, I mean, 3 weeks ago everyone was watching the Blue Jays game, everyone was really revved up. It was hard, it was easier actually probably to fall asleep because we were going to bed so late. But in some people's cases, that much adrenaline in their systems, it takes a little bit longer to fall asleep. So wait before you get into bed. Wait until you're sleepy. Get out of bed at the same time every day. So again, there's that consistency, and you're starting the day at the same time. So if you think about that sleep balloon, you're allowing that time to pass before you get sleepy again. If you're getting up 2 hours later, then that much time then needs to pass before you're going to be sleepy again. So you're not going to be sleepy at your normal bedtime if you're sleeping in 2 hours longer.
Yeah, I know. I'm picking up lots of little things.
Nap for
that I'm doing.
sleepiness. I point this out because in a lot of cases we nap out of habit or because we're just exhausted and fatigued. Fatigue is different from sleepiness. Fatigue is just I'm bored, I'm tired, I'm exhausted, I might not have had enough to drink water, I might not have eaten enough protein. So be really clear about how you're feeling and what your body might need, and not for sleepiness. So if you are doing the head bob, sure, go have a nap, make sure it's between 1 and 4 p.m. and no longer than 45 minutes. And last but not least, don't cancel your workouts. Exercise has been proven to lengthen and deepen sleep. The other part of CBTI is only using your bed for sleep. So we want to avoid incompatible sleep behaviors, meaning not staying in bed when you are feeling anxious, stressed, worried. It's okay for a little while, like we were talking earlier about distracting techniques you can use, like playing golf, shopping, thinking about your teachers, maybe doing a breathing exercise if you notice you're awake and not sleeping. If it feels like it's been longer than 20 minutes, however, get out of bed.
In the night?
Because our brains are extremely associative. And so if you start spending time, wakeful time in bed, this is one of the other pieces that leads to insomnia, is our brain starts to associate our bed as being a place to be awake.
Then what do we do when we're awake, wandering around?
So, good question.
I get up and do laundry sometimes.
Yeah, you can get up and do laundry, you can get up and sit on the couch and read your book, do a Sudoku, listen to a meditation, you know, draw. I know people that will get on their computer and start making photo albums. You can put your computer into nighttime mode so you're not getting that white blue light, but you're just trying to distract yourself, and essentially you're trying to down-regulate your nervous system so that when you get back into sleep, or when you get back into bed, you'll be feeling more calm and the sleep wave will be able to come. The other piece I have on here is exerting effort. Oh, sorry, you want to ask?
Do you go back to the beginning of the sleep cycles? Like, do you go,
Good
you start
question.
with deep sleep, right? Or do you pick up where you broke off?
I don't know. That's a great question. I would imagine you pick up where you broke off, because your body's always trying to maintain homeostasis.
Okay. And then when you say don't, so like, often if I wake up, I wake up almost every night around 3, use the washroom. If my brain starts to hamster wheel, I have this app called Calm, I think a lot of people use it, that'll knock me down in 3 minutes flat. I've never made it to the end of one of those sleep stories. Is that,
Well, if it's working, great. It's not broken.
okay,
Ideally, we're not using the bed for wakeful activities, but I mean, I'm not gonna say. If it was like a major issue and you were lying in bed for 2 hours listening to sleep stories, I would probably suggest not doing that in bed. I would say get out of bed, listen to the sleep story, get back into bed. But if it's knocking you out in 3 minutes, I'm gonna say there's not an issue.
okay. Yeah, that's kind of what
And here's the other thing, and I should have shared with you a hypnogram, but it is normal to wake up at 3 a.m. It's just not normal to be awake for a long period at 3 a.m. And that's why I say rule out anything that could be creating the prolonged wake up. So is it other things? But the other piece of the puzzle is we do wake up between cycle 2 and 3 and 4 and 5. If you want to, I can actually dig out a hypnogram to show you this, but as we cycle through our sleep, there are 2 times in the night where we normally come up for air. It's just that we don't want to, it's normal to get up and go pee and go back to sleep. That's completely normal. I think we get into this idea that we should have 8 hours of uninterrupted sleep, which is bullshit. Sorry, Sarah.
I keep trying to tell my husband that.
Yeah.
He's like, I woke up in the night, I didn't get a good night's sleep. I'm like, yes, you did.
Yeah, just because you wake up and go to the bathroom or roll over, or, you know, hear your teenager coming home at 2 o'clock in the morning, it doesn't mean you had a bad night's sleep. If you were able to get back to sleep again, you know, base it on how you feel in the morning, right? Or do you feel like you were well rested? Don't base the sleep on the fact that you woke up once, because it's normal to wake up. It's normal to have sleep disruptions. It's how we respond to them that worsens the sleep issue. And I'm gonna lead into this last point here, is the exerting effort. If it feels like you're working to sleep, then something's off. Because when you talk to a good sleeper, they're not doing anything. They don't have like any particular thing they're doing in order to sleep. They're they're letting their body do what it was designed to do, right? So if you feel like, okay, I've got to have the eye mask and then this on and then this on, and you know that you feel like there's too much work, that is kind of a red flag that you might be getting in your body's way. Because when you're working, what's happening? You're forcing it, you're tense. You know, you might notice your breath is a bit more shallow. And when you're in that physical response, the sleep wave is going to have a harder time coming because you're in more of a dysregulated state. Remember that sleep needs relaxation, it needs letting go. It doesn't need effort, it needs letting go. And that's part of the practice. Last but not least is making the bed a strong cue for sleeping. So this kind of just goes on what we were just talking about, going to bed when you're sleepy, getting out of bed if you feel worried, anxious, frustrated, or you feel like you've been awake for longer than 20 minutes. Use the bed for sleep and sex only, and only not for sleepiness or when you feel it is necessary for your safety. This is actually the last but not least, is prioritize your wind down routine. This is an effort. This is setting your body up with rituals and routines that cue the brain that it is time to let go and relax. Shifting from that doing self to the being self. Setting up sleep associations through routine and ritual, right? Brushing your teeth doesn't have to be a big production. Literally brushing your teeth, putting your pajamas on, and you know, I don't know, stretching for 2 minutes. That simplicity can set your brain up. It's just like we did with kids when they were little, right? You have their bedtime routine, that's what we're doing for ourselves. It's the beginning of letting go that happens during sleep. Dimming the lights helps strengthen our sleep processes and helps to promote melatonin release. And if you're allowing that time to process the day and shift into that sort of non-critical problem-solving part of the brain. If you do notice that when you wake up, you immediately shift into problem-solving and list-making, there is a strategy called constructive worry time, and I don't know if anyone's ever heard of this. Or a brain dump, and essentially you do that. You do the 8 p.m., you dump it all down on a piece of paper. These are all the things I have to do tomorrow. These are all the things that are taking up a lot of energy in my brain right now. I have to get the tires changed, I have to buy this present because Black Friday is coming. Can't forget to book that doctor's appointment. You do that in the first column. In the second column, you give yourself one strategy to address the problem, right? I'm gonna call Friday morning, I'm going to set an alarm on my phone. You address the problem, essentially. Create one strategy to deal with the problem. Then you fold the paper up, you put it away, and when you notice yourself going to that problem solving, you remind yourself, I've done my worrying, I've done my problem solving, it's time to rest. It's time to rest. And it's a practice, but it will help to shift into that being rather than that getting into that anxious state. Reminding yourself, I've done what I can today. I don't need to do anything more. I'm just gonna rest.
Any advice on travel, jet lag, how to avoid it?
Yeah.
How to sleep on planes?
Yeah, absolutely. Melatonin can be helpful for time zone. Really just trying to get yourself onto the time zone immediately. You won't avoid it, you can't avoid it, but getting light in your eyes and trying to shift to their schedule, so staying up, even if it's killing you, or if you're going to Europe, land, try and get your hotel room, like the night before, even pay for one extra night, so that you can go have a nap, an hour and a half, and then get up, and then carry on through the day, and then go to bed at their time. Sleeping on planes, noise-canceling headphones, game changer. Masks, again, you're trying to send messages to the brain that it's time to sleep, but it's hard, and so also finding some compassion for yourself, like, yeah, it's gonna be a crappy night. Not gonna sleep very well, I'm not gonna sleep on the plane very well, but I'm gonna do my best. Using the calm, listening to sleep stories, music that you find relaxing. Remember, the ingredients for sleep are that letting go, right? So anything that's gonna help with that, the deep breathing, the relaxed muscles, feeling warm warm and cozy. So bringing a blanket or like a cashmere scarf or something. So, in summary, I just want you to know that I don't accept poor quality sleep as, I don't want you to accept that for yourselves. There are things that you can do to treat what could be something else that's causing the sleep disruption, and if it's not, there's things that you can do to support that sleep regulation, that sleep-wake cycle. And moving into that place where you trust your body's ability to do what it was designed to do. So thank you. Okay, so that just really, no, and you know what, that actually, I should have talked about that, is that is a very, very common experience for women especially, like you wanna retreat. It's a place that you go to escape, and there's nothing wrong with that. Absolutely nothing wrong with that. That's your body's way of telling you you need to take care of yourself. My suggestion is find another place to do that, or if you can go to your bedroom, do you have a cozy chair? Do you have like a nook in your bedroom that you can still escape to, but it's not your bed? And last resort, move to the other side of the bed. Sit up. And I actually recommend this for my older clients as well, that I don't necessarily want stumbling around in the dark at nighttime to avoid potential injuries, is just move over. Like that's how, like, our brains are so crazy, they're so smart, right? But that little shift is enough. Sitting up and being on the other side of the bed, I mean, if you've got a bed partner, that's a challenge, but it's not story. But I don't suggest going to a guest bedroom. I have a lot of clients that play musical beds, and it's not a good strategy. You really want to identify, where do I want to sleep? Where do I want to sleep? And that bed or that is where you sleep. So you go there to sleep. If you're not sleeping, you get out, you go back to sleep. Finding another nook, so creating another spot that feels like it's the same, providing you with that same escape, but isn't your bed. And in the mornings, also having something to get you out of bed, like a really good coffee, a date with a friend, and going back to the nook. But it's, yeah. Any other questions? Everyone feeling sleepy?
So I guess when you're lying there, on those times when it does last a long time, well, then you get up, okay, so you do things, you go on, you said you go on. I find that just wakes me up for the rest of the day. I much better, I sit up in my bed and I read, and my head starts to bob after about 15 minutes. It's in the bed still.
So that's okay.
And then I can go back, but I'm not lying there.
Yeah.
But if I go into the living room, I'm there for the rest of the.
Well, it does take effort. So,
Nice.
so yes, going to the living room, oftentimes people will say they either end up feeling like they'll either fall asleep on the couch or and I don't think this slide was on here. Was there the alerting one? Yeah. So you can see that what happens as the night progresses, that alerting signal, this isn't really, that's not helpful. I guess what I'm trying to say is that the closer it is to morning, the less melatonin we have in our systems, right? And cortisol's starting to rise, so it will be harder, especially if there's any external light, to go back to sleep. So at this time of year, it's not as difficult because it is darker, although it is a bit later in the morning right now, but just try and keep things really dark so that you're not sending messages to the brain that, okay, we're done. So that's why it's like 10, 15 minutes and then go back to bed. But if you're sitting up and reading and finding yourself going back to sleep in 15 minutes, then that's fine. Because you're sitting up, you're not lying down.
And I know you talk about don't move your sleeping spot around, but what if your sleep disruption is partly caused by your
Partner. So, yes. I mean, in some cases, people will make the decision to sleep separately, right? So there's lots of different like steps to that. It doesn't necessarily mean it's good, like it depends how they're disrupting you. So if it's noise related, then you can try, I mean, you've probably already done this, but earplugs, noise machine. A noise machine can help neutralize their noise. But if they're snoring, then they might need a sleep study.
Yeah.
But then if the situation allows for you to have 2 separate bedrooms, and that is agreed upon, then there's nothing wrong with that.
And so your body will start to associate the new location.
Yeah, absolutely.
Pretty quickly.
Yeah. And then you can set it up how you want it. Yeah, and I mean, the Scandinavian way is to actually have 2 separate beds together. So it's like 2 single beds, 2 sets of sheets, 2 duvets for temperature and just movement so that your mattress is not being moved by them.
Yeah.
So there's lots of different angles to kind of address this, but I think that we get really caught up in like, you know, especially, well, I mean, our beliefs around what sleep has to look like with our partners doesn't have to be what we've maybe been told.
Yeah, I was thinking about it more from the perspective of changing your place of association.
No, it's fine. No, I mean, the fact is that our brains are really habituated quickly.
Okay.
So just like they were habituated into one way, they can be habituated into another equally as quickly. Yeah.
Do men, I just feel like my partner sleeps all night. He very rarely gets up or very, just the whole night.
Well, what do
So
you?
frustrating.
Yeah.
Why the hell are you asleep?
Especially when you're making so much noise.
I have a lot of male clients. So although it feels like it's just women, I would say that the difference is that women are usually the ones that are carrying a lot more, have a lot more responsibilities, are thinking a lot more, are juggling a lot more, you know. But that's not always the case. I mean, I have a male client right now who's really struggling. But he is actually, when I think about it, the one that's holding down the fort. So that's why I say there's lots of factors. Yes.
I've just all my life been labeled a light sleeper, and you talk about your partner. It just if there's a storm or the wind's howling or there's a crack or the furnace made a noise or something, and all my life I've been that way, and I just so I can sleep, but right now I'm aware of all the different things that are happening. And it wakes me up, and I wonder, what was that? Or the storm, or even though we have room darkening and the darkening shades and it's black, the minute there's a bit of lightning, you know,
You
and
pick up on it.
yeah, and I've tried maybe switching sides because I was near the window side, but it's just incredible. And you talk about a teenager coming in at 2 in the morning. I could be dead out, but I could hear that door
Yeah.
open. You know, and it's just something, I share rooms, traveling with friends, and I'm the one that will notice the least little sound.
Yeah. And so
It's just all my life, so I just accepted. I tried earplugs. I had them professionally made with the audiologist, and it's just my nature.
Well, and it also has a lot to do with nervous system, right? Because again, coming back to that concept of like, in order to sleep, we have to feel so safe.
Yeah.
And so if there was, and this is why psychotherapy is an aspect of what I do with regards to sleep, is that sometimes past experiences that you don't even know have contributed to that alerting system, right? Because your nervous system is on alert, it's looking for danger. So if it's picking up on those cues, it's trying to keep you safe, right? Even though cognitively we can say like everything's fine, it's just lightning or whatever, but it's because it's kind of looking, it's scanning, and that may be because of, you know, you did shift work, that could have played into it, you know. So what I'm really hearing is that acceptance piece. There's a part of you that's just like, this is who I am.
They will just say she's always been a light sleeper.
Yeah.
Friends, family, and I've accepted that.
Yeah.
But it's just, but I'll go back to sleep after
Yeah.
I realize.
Yeah.
that crack of thunder.
So
which
that's
is thunder.
great, that's good, that you that your body will just be like, okay, and then
Or
back in.
someone's, you know, if you're in a house, you're on vacation with girlfriends and we're sharing an Airbnb, and someone gets up to use the washroom, I'm the one that hears the
Hears
floor
it.
creak. As they're trying to be
It's
quiet.
normal though, isn't it? Like, I think if there's a big thunderstorm, if I sleep through that, I'm, wow, how did I sleep through that? Like, I feel like.
Well, and it also
It should depends on where you are in your sleep cycle.
I was gonna say, it 100% depends on where you are in your sleep cycle. If it's the beginning of the night, that's your deeper phase of sleep, so that might be when the thunderstorm was, whereas if it's in that REM sleep phase, you are in a lighter phase of sleep, so the chances of picking up on it
That's
are.
probably a very good thing, because you go to bed early, and then now that explains something, because it's usually in that time.
Yeah.
That someone's trying to sneak in and, you know,
Yeah.
it's a teenager, 2 in the morning.
Yeah,
What about, times when there is significant stress, so that's, you're in the hyperspace,
Yeah,
call it
good
state.
question.
And
Hyperarousal.
that, you know, invariably that dissipates at some point.
Yeah.
Life is that way.
Yes,
But when you're in that period of time, is there some strategies or
those strategies that I suggested,
same thing?
that is how you support yourself during that time, is because you are going to have more disrupted sleep when you're going through a stressful time. So it's recognizing, okay, what are the things that I can do, and don't do the other things. So keep getting up even if you've had a poor sleep. Keep getting out of bed or getting up and reading and just saying, okay, I'm gonna get up and then I'm gonna try again. It's just, you're meeting it with consistency, and then it will pass a lot quicker. And it won't get into that next stage of chronic or acute or chronic insomnia. But that's a really good question. And it's hard because it feels so what's the word? Catastrophic at the time, right? But recognizing that your body, it wants to go back to balance. It wants to be balanced. So it will take care of you, and it will make the sleep that you didn't get more of it the next night, and it'll constantly be regulating.
Thank you so much.
Oh, you're so
Okay.
welcome. Sarah.
Just one quick thing, I've heard that, like I know you talked about melatonin and getting light first thing in the day,
Yes.
set you up for sleep that night.
Yeah.
I've also heard, breath work in the morning, or like some sort of meditation, or even just a couple of minutes to start before you start your day, just from an overall nervous system point of view, that it makes sense to do it at night, but I've heard that actually doing it first thing in the morning sets you up for your sleep that night.
I would agree, and I would also say that also anytime during the day when you feel yourself either being dysregulated or just scheduling a time to regulate again. So setting yourself up in the morning is a great way, but also maybe having another time of the day where because if things start to get stressful, then it can help kind of bring it down a few notches so that when you do go into bedtime, you're not going in up here. Because again, even though you might fall asleep, if you wake up, your nervous system has a tendency to go back into that dysregulated state if you're especially going through a stressful period. So breath work is really, really helpful, and it doesn't, again, have to be a big production. It can be like 5 deep belly breaths. Box breathing is a really good one. Is everyone familiar with that one?
What's that? I don't know.
Breathing in, you imagine yourself like tracing a box. So you breathe in for 4, you hold for 4, you exhale for 4, hold for 4. And you're just imagining that visual of holding, exhaling, holding. It's just called box breathing. It's just a way to visualize, give yourself something to focus on while you're doing the breath. Or just breathing in for 5, breathing out for 5, but really deep belly breaths.
If you have an Apple Watch, there's a breath app on the watch, which I wear mine at night because I use it. So if I wake up in the night, I can barely see it anymore in my glasses, but I scroll to the app and I put it on, and it's set for 5 minutes, and I usually fall asleep before it actually finishes.
What does it do when
It
it's
does
on?
like a really gentle like vibration on your arm to breathe in, and then it does nothing, and then again. So it sort of times out, I think it's more like 3 seconds in and out, maybe 4. But there's
So-
no holds in that, it's
Yeah,
just a
and-
breathe in and out, just a rhythmic sort of thing that's sort of relaxing.
And I will add to that that's helpful, but you can also just do that, right? And I will tell you the breath pattern of someone sleeping is 5 or 6 inhales. Like if you watch someone that's sleeping, it's like an inhale for 5 or 6 and an exhale for 1 second longer usually, so either 6 or 7. So it's inhale and then exhale. And if you just kind of move into that breath pattern, you will immediately bring down your heart rate and downregulate your nervous system. And it doesn't require anything. You can just do it. So you can do it during the day, you can do it in the night if you wake up, but I think Sarah's point, doing it during the day is really impactful, either setting yourself up or helping your nervous system to settle a bit during the day so you're not as dysregulated at night.
I take magnesium.
Mhm.
I find that helpful. I did have one that was called sleep support though, and it had magnesium, it had melatonin, and it had GABA, and I did not like that. My dreams were way too vivid taking that.
I just found out that it helps with the restless leg.
Yeah, I think the magnesium.
Yeah, I have to pretty much have to take it every day.
The magnesium is really supportive. But again, it's like also just recognizing that it's not gonna be the magic wand. It's a support, so putting those supports in place to help is what we wanna do. The ones that are proven to be effective. All right, well, thanks so much for coming out.
Thank you.
And I
Thank
know
you.
that was a lot of information, and yeah, I think I had my